Essential information about anxiety depression by John Paul Richards. People who exert a considerable amount of brain power on a regular basis can easily exhaust both their mental and physical strength. Studies have shown that multitasking frequently taxes the brain beyond its normal capability. Rather than sharpening the mind, as some people have been led to believe, numerous individuals who lead busy lifestyles rarely give thought to rest and relaxation, both of which are vital to everyone's well-being. Maintaining such a lifestyle without at least an occasional break can take one at risk of mental illness. Emotional problems such as anxiety, depression, and nervous breakdowns. If you live such a lifestyle and find yourself unable to release stress in a positive way, or you cannot seem to stop worrying over various issues, you will be pleased to know that effective treatments are available. Anxiety depression is characterized by a specific set of symptoms exhibited by the person who is suffering from the disorder. Certain events and situations act as triggers and exacerbate such symptoms. Before searching for an effective cure, however, it is important that you obtain a definitive diagnostic from a reputable mental health professional. Various forms of depression. Manic depression, also referred to as bipolar disorder, is categorized as a radical mood changes that occur suddenly, ranging from euphoria to extreme depression. Postnatal depression, as it's known, implies occurs after childbirth. This type of depression is quite different from what is commonly known as baby blues. Women suffer from disorder typically feel sad and lifeless from prolonged periods of time for no apparent reason. Depression of this kind is usually the result of hormone imbalancement. Dysthymia is a type of depression that causes an individual to feel blue despite the fact that there are no major problems in his or her life that would result in a low mood. It is not as debilitating as other forms of depression, and sufferers can usually perform tasks adequately but rarely function at an optimum level. This low-grade depression can last for several months or years. Cyclonemia is somewhat similar to bipolar disorder, but its symptoms are less severe. Seasonal affective disorder is a seasonal specific depression. Those who suffer from the condition experience a low mood throughout fall and winter when less sunshine is present. The most common type of depression, although aforementioned variants of depression affect certain individuals, the most common form of disorder is anxiety depression. The latter is regarded by mental health professionals as a state of constant anxiety that goes beyond the normal jitters one experiences when taking on a particular stressful activity. This form of depression is much more than a case of nerves. In many instances, it is a hereditary mental illness or the result of a chemical imbalancement in the individual of the brain. Generalizing anxiety disorder is a type of depression that can result in panic attacks or other unpleasant episodes. Other symptoms include insomnia, chronic fatigue, and inability to concentrate. This form of depression is non-incurable. However, not all treatments will work on every individual, as in the case with all forms of disorder. If you suspect you have anxiety, depression, or other forms of illness, it is wise to consult a reputable cognitive behavior therapist or psychologist with whom you can discuss an appropriate treatment for your illness. If you want to know further regarding this, I have a free book named Beat Depression. You can see, as you can see on the screen, www.jsdirect.co.uk/Beat Depression.